from breakthrough strategies to game-changing innovations and cultural shifts. You'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. Today on The Missing Piece, I'm honored to welcome Amit Shah, president of Virta Health, a company transforming healthcare delivery by helping reverse metabolic disease. Amit has spent more than a decade building and scaling high-growth healthcare organizations with a focus on mission-driven leadership, operational excellence, culture, and measurable outcomes. Before Virta, he worked in primary care and clinical operations, where he saw how often chronic conditions were treated as something patients simply had to manage for life. What makes Amit's work so powerful is that Virta is challenging that assumption through personalized care, innovative technology, and a deeply patient-centered model. Virta is helping prove that better outcomes and real transformation are possible. Today, we'll talk about Amit's journey, what drew him into healthcare innovation, the future of chronic disease care, and what he believes is the missing piece in the way we support patients and transform health at scale. Amit, welcome to the show. Thank you for being here.
April, I'm so grateful you asked me to join. Thank you.
I am excited to learn from you, hear from you. Clearly, innovation and care is the heartbeat of who you are. So I'm really excited to hear your story. For the audience that's never heard your story or don't know who you are, please introduce yourself.
Yeah, thank you so much, April. I'm Amit, as April shared. And April, your introduction was great around what Virta does. So I'll focus for a moment on me. I grew up in Michigan and studied engineering. I then was a consultant for a few years at a company called McKinsey. I left consulting and I started a business that made solar products for rural India. And so there are two things about that are interesting. One is I went and started a business. I had my first entrepreneurial experience. And two is the business was very much a social enterprise. So what I learned about myself from that experience was how much I loved working on things that improve the quality of life for people. So we'll come back to that a little bit later, but that was a key lesson that I learned. That was a really tough business to scale. We ended up selling it to an Indian company. I went to business school on the West Coast. And then after business school, I wanted to, again, work in a place where I felt like there was a real mission and we were really helping people. And so that's what got me into healthcare services. And as you said in my intro, my first gig in healthcare services was around direct primary care. So better access and delivery of primary care to improve people's health at a lower cost. And I was at a startup that did that for about 4 years. And then I heard about Virta. And when I first heard about Virta and this metabolic disease reversal approach, I was a little bit incredulous. Later in the podcast, maybe we'll come back to the story that changed me, but really it came down to meeting some of our first patients and feeling that same impact that I felt when I was in India. And so that's what got me to pick Virta. As you shared, I've been here for about a decade. And then outside of work, I'm married. We have two wonderful kids. They're in their younger ages. They're 5 and 3. And I have a dog, and I'm based out here in Denver. So that's me.
I love it. Thank you, Amit. So I want to go back a little bit because we have a lot of younger listeners too that are in university. And you had said that like you were studying engineering, and then you fast forward to your career now, obviously having startup businesses. When you were younger, like what did you think you would do and what did you want to do? And then what did bring you overseas? Tell us a little bit more about that. Take us back a little bit to the beginning.
Absolutely. April, when I was really young, I wanted to play tennis and rock star and all those things.
Yeah.
But those really didn't pan out. You don't want to see me play tennis or sing a song. Getting into high school, I went through a variety of doctor and, engineer, et cetera. And I kind of zeroed in on engineering based on a real love for math and science. And honestly, when I got to my freshman year at Michigan, I took an intro to engineering course, and I actually really enjoyed industrial engineering. And I know I've said this to many people, I loved my major. Like I would take classes and I would really enjoy them and get into them. So one thing I would say to younger folks is like, find something you enjoy learning about. I think that is a key and that is important. Now, fast forwarding, how did that lead to healthcare and all? I think in addition, there were some experiences when I was younger that nudged me towards more social enterprises. So one of those is that when I was 16 years old, I spent a month in a rural part of the Dominican Republic building homes. It was through a high school project. where 20 of us from the Midwest region went down and did that. That was really influential to me. I was really drawn to working on something that, again, improved the quality of life for people. When I was in college, there was a professor at Michigan's business school who wrote a book that I would reference a lot later when I was doing my first entrepreneurial journey in solar products. It was called Fortune at the Bottom of the Pyramid. It was written by a professor named C.K. Prahlad. And his whole thesis was that we don't invest in people that live at the bottom of the proverbial economic pyramid as if they're consumers. And if we built products for them, we would see a lot more impact in economic mobility. That was really attractive to me. I got interested in that. That I could apply to industrial engineering. Industrial engineering was about building things at lower cost, et cetera. So that was that first experience. And it turns out, I'm going to fast forward all the way to healthcare, pulling those two things together. I have found that a lot of healthcare is built on systems and processes. And when we reevaluate how those systems and processes work and improve them and make them more efficient and more patient-centered, member-centered, you can actually have a pretty big impact. And so, is it all tied together as a complete thread? As Steve Jobs famously said in his Stanford commencement speech years ago, looking forward, I wouldn't have connected the dots, but looking backwards, I definitely do.
I love that. It's interesting because hearing your story, like you said, it's like going back to, you go from like engineering to overseas to startup to healthcare to disrupting and trying to completely, be a game changer on metabolic disease, which and reverse it. It's just amazing. But I do believe, like what you said, just let the dots line up, like let them line up for like what inspires you, what touches you, what speaks to you, and then pursue it and go after it. And then it's almost like all roads lead you to the right time when it's supposed to be the right time. So, I love it. I think your story really, really speaks to that. And then also not being scared to try new things. Like, I'm sure you weren't going to be like, when I grow up, I'm going to start a business. And then it was really hard. And you're like, I guess I'll sell the business.
Yeah.
You just never know.
I often say that. I say like, you have to really want something. You have to want the actual thing. I think sometimes like working as a means to an end is its own thing, but like, you have to really want it. And then you have to be incredibly curious and incredibly persistent.
Right.
And I think when you combine those things, to your point, the dots end up starting to line up.
So obviously the project you said that you had in the Dominican Republic ongoing, I think you said in building homes. Do you think that did something inside of you on improving people's quality of life that has now even brought you to Virta and what you guys are doing? Like, do you feel like a part of your leadership has been, how do I make a difference in someone's life? Like, was that a defining moment and that carries you even to today?
Yes. And I would say there have been a series of those defining moments. I didn't leave the Dominican Republic and at 16 and think to myself, I will have a career in this. I didn't read C.K. Prahlad's book when I was a junior or senior at the University of Michigan and think, I'm going to have a career in this. I went to a consulting company, right out of school. It was prestigious. It was exciting. I learned a ton while I was there. It was a really great experience to set the business fundamentals and foundation that I needed to develop as a professional. And then an opportunity came up that literally combined the Dominican Republic experience and the book that I read, and so I took it. And to your point, I took a bit of a leap and said, hey, what does that look like? And then, and I learned and I enjoyed and got curious and like figured things out. And then again, I didn't leave that and say, okay, now I'm going to go work in healthcare. I actually left thinking I would end up doing something similar post-business school. I was like, I'll probably come back to the, developing nations and I'll work in clean tech, because at the time that was like really, it still is interesting, but it was really hot and I was interested in it, and it leveraged my more manufacturing supply chain skill set. And then in business school, I met a friend whose dad runs one of the largest hospitals in India. And I learned about how they were delivering surgeries for low cost and thought, man, this leverages my operational skill set so well, and it really helps people. And then that's what nudged me into healthcare. And so all that's to say that it certainly hasn't been a moment. It's been a series of moments, a series of nudges, some of which I've taken, some of which maybe I didn't take and would have landed me somewhere else, So, but this is how it went.
Your story is really resonating with me because, even like right now for me personally, I feel like all these dots are starting to line up, and it's like you wonder why, and then you just wait for those moments. You're like, oh, that's why. Well, let's talk about Virta and the life-changing things that you guys are doing. What brought you to Virta? How did that door open? I call those sliding door moments, where you're supposed to be there, you're doing what you're supposed to do. Tell us more about Virta.
Yeah. And though you gave a great introduction, I'm going to do a quick 30 seconds on what is Virta, just to provide that context. I think of Virta, when I tell new people about Virta, I say we're the leader in reversing metabolic disease. And what that means is we use a nutrition first approach combined with continuous medical supervision and AI to address the root cause of metabolic conditions. And I also note that metabolic disease affects over 93% of adult Americans. And so this isn't a niche piece. This is over 93% of adults are impacted by this. Because GLP-1s are very popular and they're tied with metabolic disease, I'll also say that, as part of the GLP-1 story, we support patients before, during, and after GLP-1s. Our core program is to help people improve their health so they can avoid the medication entirely. When appropriate, we prescribe GLP-1s as a tool in the broader disease reversal toolkit. And we're the only company that has peer-reviewed published data around getting people off the drug, sustaining the weight, and sustaining their metabolic improvements. And so where we are today is we're scaling that business and we're on a mission to reverse disease in 1 billion people. So how did I get there? How did this all line up for me? Honestly, it was cold outreach from the co-founder and CEO. Sami, our co-founder and CEO, sent me an email, and I was incredulous when I first spoke to him. I took the meeting. I said, "Oh, he sounds like an interesting person. Sami's got a very interesting background. He is an entrepreneur himself. We went to the same business school, and so kind of, I was able to reach out to people who had told me, yeah, he's a really good person, good guy to work with. So I took the meeting. And when he first told me about metabolic disease reversal, I was skeptical to say the least. I mean, more than skeptical, I really doubted it. Again, I worked in primary care. We couldn't get patients, for example, with type 2 diabetes to be adherent to their meds and to come in and get their labs regularly. And he was showing me data around how patients came off of their medications and maintained a healthy blood sugar. And so I was just incredulous, but I kept getting curious and learning more. He is a very persistent person. And so he allowed me to get curious with him. It wasn't like, oh, if you're not interested, see you later. It was like, oh, he would send me some data. And then again, I kind of mentioned this in the intro. The turning point for me was when I met some of our first clinical trial patients. Virta started with a clinical trial in 2015, so over a decade ago. And the result that those patients see, I remember one patient in particular, she had diabetic retinopathy, a very out of control A1C, was overweight, et cetera, was on multiple medications. 9 months after being on the Virta treatment in our clinical trial, she had come off of all of her diabetes specific medications. Her blood sugar was in control. And then the two that really got me, she had lost so much weight that she had reduced her knee and hip pain. She had lost about 8 to 10% of her body weight. And then the one that blew my mind was her diabetic retinopathy had improved so much that she was able to see again and then able to get a license and go back to work. And when I heard her story, literally it was a click. Like, if I want to have an impact on people's life, if I want to improve the quality of people's life, I have to give this a shot. So that's how I ended up here.
Wow. That's incredible. The statistic that you said that 93% of Americans.
Yes.
I mean, that's crazy. I mean, that's a lot. That is a powerful story. I love hearing the one, because you need that one story, you know what I mean, that just moves the needle, makes the difference, inspires others that are listening, saying, I want to be that one, to be a part of it. So how long have you been at Virta since?
I've been at Virta for just over 9.5 years. I haven't hit 10 just yet, but this summer I'll hit 10 years. Yeah, 10 years.
Wow.
And it's been incredible. It's been just,
Awesome.
the huge joy to be here and be able to scale this model and help so many people.
So let's talk about the fact that you worked in primary care and you worked in the healthcare space, and now To your point, you're saying, listen, you can't get the patients to even come back for their labs or get them off their meds, or you're increasing their meds or putting them on more meds, whatever the case may be. I mean, now having been with Virta almost 10 years and literally reversing metabolic disease, what are the gaps? Like, what do you think? Why? Like, what is the health system? I don't want to say doing wrong, obviously, but where do you think the missing piece is in that?
Yeah. The first comment I'll make is that I have found healthcare to be filled disproportionately, potentially. Again, I've worked in this industry now for 15 years, so don't have as much exposure to other industries, but disproportionately filled with people who mean well and want to do well by other people. And so the reason I say that is as I go on to my next comment around the missing piece and why I don't think it works, it's actually not, by and large, malintent, nefarious behavior, et cetera. Because again, that gets sensationalized, right? You'll read the Wall Street Journal talking about Medicare and Medicaid fraud and blah, blah, blah. And does that happen? Absolutely. Is that like a problem? And totally. But is that the problem with healthcare? No. At its core, I believe the problem with the US healthcare system are the economic incentives. The way we have set up our healthcare system, and again, this goes back to the 50s and 60s with employer-sponsored healthcare, et cetera, et cetera, et cetera. The way we have set it up is we pay for work done. And so if you are in the healthcare system today, by and large, your incentive, economic incentive, is to do more work, to see more patients, to drive more lab tests. That is paired with so that's the economic model. So if you want to be successful economically, you have to be doing a lot. Paired with that is a relatively litigious society and approach where then you're also incented to do more things to cover your bum, and to make sure that, no one can come back and say, well, you didn't diagnose such and such and blah, blah. And so that drives up cost. And there is honestly very little economic incentive to keep people healthy and out of the system. Yeah. It is a sick care system. Mm-hmm. And so all the things that we do around preventative care and nutrition, improving people's nutrition, improving the food they eat, which is the core of our intervention. Yeah. The reason it's so valuable, by the way, we partner with risk-bearing entities and put 100% of our fees at risk for hard outcomes. Yeah. And so I just want to be very clear, like we are putting our money where our mouth is, and we make, our economic model is aligned with what's good for the patient and what's good for the risk-bearing entity. And the reason that is possible, though, is because the rest of the system works this other way. And so we are able to reduce visits to other providers. We are able to keep people out of the ER. We are able to reduce inpatient hospitalizations by making people healthier. That's how we make money, by making people healthier. But the fact of the matter is, when you keep people healthy, the vast majority of the system is not economically incentivized. Again, I'll go back to very good people working in their best interest and not, again, trying to do anything overly nefarious. But also, the system is built such that, have to drive more work to get more economics.
More charges. Yeah. Bill more. Yeah. Bill more, be paid more, see more patients, repeat. Yeah, unfortunately. I've had several actually longevity medicine physicians on that have been in the ER practicing for 20, 30 years. And then they decided they want to work with the patients that want to get healthy. There is a better way. And we really can create a culture of healthy living instead of sick living. To your point, it's incentivized to keep them sick, unfortunately. Yeah. But if a patient genuinely wants to get better, then I think that's where Virta comes in. You're saying, hey, listen, we can genuinely make you better. And that's our goal. And that's your business model. So talking from a business model perspective, you've been there for 10 years. You said you want to impact 1 billion. Did you say? Yes. 1 billion patients? Oh my gosh. I love when there's these crazy goals, because you will, and you put it out there, it's out there, and you're going to impact 1 billion lives. Amit, how do you scale and be able to still keep the same quality, making sure the patients, are cared for, building your team, your leadership? Like, what's the secrets there? How do you do it?
April, first I want to invite all your listeners. I'm open to tips all the time. I always say this goes back to my looking for curiosity. We can always be 1% better. And the mantra, the approach that we have is around that at Virta. We are always trying to improve what we have. We have something incredible and we're grateful and proud of it. And we know it could be better. And so we're going to try to make it better. The first thing I'll say on how we scale is I'll just comment again that our economic model is such that incentives are aligned. We partner with risk-bearing entities, so self-insured employer groups, health plans. We say, hey, we will improve the health of the population that we manage, that we work with. And in so doing, you will save money. You will save hard dollar savings on medical and pharmacy costs.
Right.
And when we do that, they want to open up more of the population to us. And so again, that only works if the individual patient actually sees results. The patient wants, it's what the risk-bearing entity wants, and it's therefore what Virta wants to. And so at the core of what we do, we spend a lot of time thinking about that member experience. And then that, again, our focus point is often how to get more people sustainably successful on the Virta treatment. How do we get more people motivated to make the lifestyle, behavior, and medical changes that we are asking them to make? Yeah. When we can direct our resources so cleanly at that, we can drive a lot more rapidity in the scale. And so that's really what we do. And we leverage technology. Again, we've treated hundreds of thousands of patients now over the course of a decade. We have both longitudinal data and a tremendous amount of in-the-moment data that we leverage to drive proactive interventions. We believe in human care. We have health coaches and doctors and providers for every single patient, because what we do is lifestyle change. And we believe that humans change with the help of other humans. Yeah. We need clinicians to deliver empathy, creativity, complex clinical problem solving, and emotional accountability. But that's what we primarily need humans for. And we want to make sure our humans are doing mainly that. And so everything else we're leveraging a lot of AI for, a lot of the back office work, a lot of the administrative work. We actually also leverage machine learning models to drive proactive care. Again, we've got longitudinal data. We can see when April as a patient might be starting to fall off her plan and intervene more rapidly. We can also intervene either digitally, send you something, content, et cetera, that we think will help, or we could intervene clinically and have a coach call you, have a doctor call you, depending on what we believe is most likely to get you successful. And I'll go back to that. We're able to direct all of our resources on trying to make as many patients as healthy as possible, because our economic incentives are aligned and our mission is aligned to that. And so that's kind of how we think.
I'm inspired, and I don't have a metabolic disease, but I'm like, this is awesome. This is really good. And so you actually just piggybacked on one of my next questions from a tech perspective. Oh, my motto is ABL, always be learning. But I like what you said, the 1%. I'm like, I'm going to use that back, bring it back to my team. Like, what is 1% that we could do today better, or what is it that you're always learning? So I always say, has anybody learned anything new? How do we always be learning and applying it to our everyday life, personally and professionally?
I love ABL. I might steal that. I might use that
ABL. Too. I'm like, and in a meeting, I'm like, it's ABL time. Tell me, show me. It's like a show and tell, because with AI and technology and the tools, everything's going so quickly, but in a positive way. I'm taking it in a positive light, because I'm seeing as a business owner, like, how can we make a bigger impact? So that was my question for you, is coming up on your 10th year, AI where it is today wasn't there 10 years ago. How have you guys implemented the tools in order to probably scale even faster than you ever have before, and or, like you said, get to the patient quicker? What has kind of been that evolution? Like, I've always been on the EHR side, and I remember paper. I remember the implementation of EHR, and now, and now I know AI, and And we do, AI literacy and governance planning now and how to use it and make sure that they're protected. So it's neat to be on that journey. But tell me a little bit the tech journey that you guys have been on as things are flying.
Yeah. I would credit Sami, our CEO, as being a visionary from a decade ago around this. When I joined Virta and I was one of the first 20 employees, we already had a machine learning engineer on staff who was looking at a lot of our data. And at that time, our primary data source was our clinical trial.
Yeah.
And so AI has been a part of our plan. Machine learning and AI has been a part of our plan since day one. Most of our entire substrate on care delivery is via smartphone. So we're an app on your phone. Again, on the back end of the app, there is a coach and a provider for every patient. And so there are humans on the back end of that app, but there's no brick and mortar clinic for Virta anywhere. Our care delivery mode is the smartphone. And because of that, we are able to track a lot of what our members do. We have thoughtful, objective tracking. So we have biomarker tracking that is a part of our program, glucose, weight, ketones, blood pressure where necessary. Then we have kind of subjective tracking around mood and the other things that you can fill out. We're looking at your interaction data, et cetera. We use all of that to proactively, with a machine learning model, to proactively figure out what is the best thing for April as a next step, for our patient as a next step. Mm-hmm. And again, the very cool part here is when I say best thing, it's what is most likely to get April to be successful and improve her health.
Right.
That's our outcome. That's the outcome we're shooting for. That's our core outcome. And again, we can look at that biometrically and via engagement. We're not just trying to engage you in our app to engage you. It's not like Instagram where we just want the dopamine hit. We want to engage you in our app so that we can help you get healthier. Mm. And so anyway, that's it. So AI has always been a part of that. Now, over the last couple of years, so let me just close that point down before I go to the last couple of years. So machine learning models have always been a piece of that. And even prior to the last couple of years where generative AI has really taken over the consumer psyche and the enterprise psyche, for good reason, by the way, the technology is incredible. We had been leveraging these machine learning models to provide proactive care and to provide and to test interventions to see, hey, like what intervention is most likely to help someone be successful. Over the last few years, generative AI has helped us even more, I would say actually help us be even more in the moment with patients. So for example, some of the tools that we've launched over the last few years, again, food is one of the key things, nutrition is one of the key things we change, is we have a food checker where you can take a photo of your food. It leverages generative AI tools in our internal database to kind of help you figure out how that fits with your plan. And then it recommends swaps that you could make on your plate to make it align with your plan a lot more. That's very in the moment for our patients. In the past, that would be retroactive. Our patients would take a picture, they'd send it to our coach would send them feedback, and they'd make the change the next day. Now they can make the change in the moment. Wow. We have an internal chatbot that's trained like one of our coaches. Again, we believe humans are necessary for long-term behavior change, but the chatbot, Viv, can be with you in the moment. And so if you're and humans just can't, right? Like you can't always just talk to your coach, your coach has their own life, it turns out, and so that in the moment problem solving, that in the moment help is something that we can provide again through generative AI. And so anyway, those are a couple of examples of how these things come together. But I will say again, we have been leveraging AI since day one, and the data set that is proprietary to Virta, which is over a decade of hundreds of thousands of patients who have longitudinally been in our care, is incredibly unique. You can't get that from, an LLM. And so that's what our models are trained on. And that's where we're able to proactively deliver the right care to the right patient at the right time to maximize your probability of success.
And make the biggest impact, which is incredible. It's absolutely incredible. So do I understand that I could just look up Virta on the App Store and download it? Is it as easy as that?
You can look up Virta on the App Store and download it. Again, our go-to-market is through self-insured employer groups and health plans who cover it for their population because it helps them have a population with improved health at a lower cost. Yeah. And so the vast majority of our patients are through that. But especially with the rise of GLP-1,
Yeah.
We are finding more and more patients who either want to, this is a stat that we just saw, is about 65% of people who want to lose weight want to do so without the drug. And another important one is about 82% of people who are on a GLP-1 today don't want to be on one for life. The vast majority of people within 1 year of coming off a GLP-1 regain the weight that they lost. And so, I mean, these are all clinical trials that we've seen. And so we have more and more people that come to our front door directly and pay out of pocket for the service because they want to avoid getting on a GLP-1, or they're on a GLP-1 and they want a sustainable way to get off, but maintain the weight loss, et cetera, et cetera.
So interesting. It's fascinating. And I love what you guys are doing, especially because there's so many people that can have a healthier lifestyle and live longer and feel good. Like you said, the joint pain, the knee pain, the back pain, like they don't have to live in pain. So as we wrap up.
On that note, just so you know, we literally just published a paper on inflammation. Wow. Where 19 of 21 inflammation markers improved on Virta in a large match control cohort. We've published a paper on MASLD, which used to be called non-alcoholic fatty liver disease. Now MASLD stands for something that I, as a lay non-doctor researcher, struggle to pronounce, so I won't try on your podcast. But essentially, we have reversed and prevented non-alcoholic fatty liver disease. We've got in publication, in review papers around CKD, chronic kidney disease, and CVD. And so that's one of the reasons I share that, there is this broader, you mentioned this thing on knee and hip pain, but this is actually peer-reviewed published data that we have on that, on all the other improvements you see when you fix this problem.
Don't you wish, you could just help everybody and feel better?
Yes.
We deserve to feel good, to wake up in the morning and feel good in our bodies, in our legs, in our knees, and all of it. But sometimes we need help, and we don't need more medicine. We don't need necessarily even more doctor's appointments, like you're saying. And I've been in the healthcare space for over 20 years. And partly why I do this. I love talking to innovators and people that are making a difference and impact on the healthcare space, because it really does change people's lives. So my last question is, somebody who wants to build something meaningful, they want to make a difference, they want to do it in the healthcare space. They're listening to this saying, yeah, sign me up. I either want to be a part of Virta, or I want to take this knowledge that I have and go make something, whatever it is. What advice would you give them?
I have a couple of pieces of advice for healthcare entrepreneurs that I've honed over the last few years. One is, I mentioned this in the podcast earlier, you have to want to solve the problem. Your goal has to be to solve a healthcare problem, because it is a very complex space. So you've got to get pretty focused on the problem and then get really curious and persistent around how to solve that. The second thing I would say, and this is because of what we've already talked about around the economic model, the area that I have found healthcare entrepreneurs get caught up the most is oftentimes healthcare entrepreneurs see a problem that, as a patient, hey, I had this experience, or I've seen this experience, and that's a problem. And one of the oddest things about healthcare in America is that patients aren't the payers. So getting an economic model that works for the problem that you want to solve is hard. One of the reasons that Virta has taken as long to scale as it has is because our economic model is around taking risk with risk-bearing entities to serve patients.
Right.
And so you have to do the B2B sales portion in order to get the patients, and then aligning that a good outcome for a patient is a good outcome for the risk-bearing entity, for the economics, and for Virta. That is really hard to pull together. So those are really the two things. One is really understand the problem, get curious about it, be persistent around it, and get ready for a lot of persistence. And two is figure out the economics early. Mm-hmm. Who will pay? How much will they? And then again, a lot more healthcare is moving consumer. So if you believe that there's a consumer play, okay, that could be true, but you got to prove that to yourself before you go too far down the line, because generally in the US, healthcare is not viewed as a consumer payment thing. If your insurance doesn't cover it, you're less likely to do it in America.
Unfortunately. Yeah. If people want to get in touch with you, can they just find you on LinkedIn? Should they just, I'll put your LinkedIn below.
Yeah, LinkedIn. You're also welcome to reach out there. I'm Amit at VirtaHealth.com. Welcome to reach out there. And I'm more than happy to connect with folks who are interested in this work.
That's awesome. Well, thank you for your knowledge, for your inspiration. I love your story, love what you guys are doing, and I'm going to watch you hit and impact 1 billion patients. I love it. And even more so, it's incredible. So thank you for your time.
April, thank you. Thank you for inviting me on the podcast, and thank you for sharing our story with your listeners. I really appreciate it.
Of course. Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.